We're continuing on in our second unit here, and we've looked at a few ethical issues so far. We've looked at animal ethics, we've looked at eugenics, and today we're going to be talking about one of the most common surgical practices in the United States. And I'm interested to see what y'all think about it. I asked you to read an article by a lawyer, J. Svoboda, who argues that infant male circumcision is both unethical and a human rights violation. So that's what we're going to be discussing today. I couldn't find an actual birth date for him, so just bear with me. This is the guy that we're looking at today. J. Svoboda is an American lawyer. He writes on issues in bioethics, most notably on circumcision. He's published a lot of different articles on this ethical issue. And he also writes on gender equality a little bit with regards to how we look at female genital mutilation and infant male circumcision in the Western and non-Western worlds. Did anybody get a chance to watch the documentary that's on the syllabus about circumcision? Did anybody look into that? Okay, well, if you have time and you're interested, you should definitely check it out because it is well made and it's very interesting. I think it'll be very insightful to you. Some of the central ideas in that documentary is what Svoboda is going to be talking about in the essay that we're going to be looking at today. He's probably most well known for his advocacy for the rights of children. So he's one of the founders of this organization, Attorneys for the Rights of the Child, in which he tries to litigate cases in which some children have had medical procedures that they could not consent to that were not life-saving. So the issue that we're going to be talking about today can be viewed through the lens of ethics, social theory, legal theory. So it's something that I think is, it's related to a bunch of different domains of human social life. So it's going to be interesting to see what y'all think about the arguments that he makes against circumcision, shall I say. So people don't normally talk about infant male circumcision in the Western world, do they? Oftentimes when we talk about issues like these, we talk about what's called female genital mutilation, or FGM. Does anybody know what that is? Have you heard about that before? Okay, what is it? Could somebody explain it to the class, for those who don't know? This is something that isn't generally practiced in the United States, but it is practiced in other parts of the world. What's going on with female genital mutilation? Yeah, Sean.
I believe the opening to the vagina is sewn shut, correct?
That's one of the forms. Yeah, one of the forms is sewing the opening shut. Another form is cutting off a piece of the labia. Another one is even shaving off a part of the clitoris. Yeah, so there are different ways that this is done, but it involves some sort of violence to the female reproductive organ, right? Or a part of it. And this is something that a lot of people talk about nowadays, and groups and institutions are coming out against, right? They're saying, end female genital mutilation. This is a barbaric practice, right? It doesn't serve any health goals. It's not good. You know, little girls can't consent to this. It's a bad, barbaric thing. And for good reason, right? It certainly doesn't sound cool, right? Why would we do this to anybody? People have been arguing for a long time that this is wrong and illegal. And there are a bunch of institutions and groups and events that are held in order to raise awareness about this issue, about where this is practiced, why this is practiced, and try to get rid of this institution, to try to dissuade people from practicing this. We might say that if there is a complementary practice that occurs, it's infant male circumcision in the West, most notably in the United States. But few people talk about this issue. The practice of circumcising baby boys is something that has gone on for a long time in the U.S. and something that is pretty ingrained in our culture. So one of the things that Svoboda is trying to do in this article is he's trying to raise awareness about this issue, because he thinks that it is just as bad as many, if not worse, cases of female genital mutilation. It's sometimes regarded as even the most common surgical practice in the United States. So while a lot of other Western countries, European countries, don't really practice this, it is one that is practiced a lot in the U.S. So again, it is a big part of our culture. Maybe a holdover from the Judeo-Christian tradition that forms our society here in the United States, right? The question is, how similar are infant male circumcision and FGM? And what exactly is done to baby boys when they are circumcised? Or older men when they do choose to undergo this procedure? That's one of the things that we'll be investigating here. This is mostly a practice that is done in the U.S. Again, in other parts of the Western world, it's not practiced that much. Other countries and organizations, other governments have started to disavow this practice, saying that it is inhumane, that it is barbaric. But for some reason, the attitudes and the policies surrounding it in the U.S. haven't followed that, right? Circumcision is still something that is practiced today. It is still something that is happening to thousands of boys every day in the United States. And hopefully today we can investigate whether or not that should be the case, and look at the ethics of this practice through the different lenses of the theories that we've been looking at in this class, in the first unit. In this article, which is one of the many that Svoboda has written on this topic, his goal is to argue and defend the claim that infant male circumcision is both unethical and it's a human rights violation. Therefore, it is illegal. It is both an illegal practice and an unethical practice, and therefore it should be done away with. It isn't something that we should practice anymore in the U.S. Or if it is something that we should practice, it should be done in limited cases, perhaps relating to religious practice or allowing boys to grow up and make their own decision about whether or not they want to be circumcised when they're older. So let's get into some of the ins and outs of this issue, some of the questions and considerations that we're going to want to look at to see if we think this is ethical or not. There are a lot of arguments that are made in favor of circumcision. Okay? One of them is that circumcision helps prevent HIV and other STIs, penile cancer, infection, and UTIs. So it's argued that circumcision has some downstream health benefits that protects boys on into the future from contracting infections, diseases, etc. Another argument that's given in favor of it is that it allows boys to keep up with their hygiene easier, right? Because it's easier to clean. This also would reduce the rates of infection and bad health outcomes, right? Thirdly, it's argued that, look, circumcision is a kind of social and cultural practice, right? That helps people kind of assimilate into a particular community or into a particular religion, right? Judaism famously practices circumcision. right? And it's a marker of somebody's entrance into that religious community, right? So one argument in favor of this practice is that, look, it helps people assimilate into their wider social community or their religious community. So it's positive in that regard, right? It has positive social or cultural or religious benefits for the person. And finally, sometimes it's argued that this is a worthwhile practice because the penis afterwards is more aesthetically pleasing, right? So there's a beautification element to this, right? It looks better than it would have otherwise. So these are the common arguments that are kind of trotted out in favor of this practice. Svoboda brings up a lot of arguments against circumcision in this piece. First, he's going to argue that it is unethical for a wide range of reasons. Okay? First of all, he notes, and this is something that actually the documentary gets into, this practice is often done on baby boys without any anesthesia. So they feel every second of it, and it causes a lot of pain and suffering to the child. It's not true that all cases are done with some sort of anesthetic, but most of them are. Another reason that he thinks it's unethical is because of how this procedure takes place. We're going to look at a picture later of like what the setup looks like of how this procedure is carried out. And this is something that the documentary gets into too, and it kind of has some graphic imagery, so if you are going to watch it, be prepared. The infant is literally strapped down, has its arms and its legs bound to, I don't know what you might call a tray or some sort of platform. And part of his body is literally cut off. Doesn't sound good describing it that way, right? And he's like, if you just imagine the practice, it doesn't sound like a good thing that we want to be doing, right? It doesn't sound like doing violence to somebody's appendage is an ethical thing. But we can talk about that a little bit later. And finally, he argues in this article that, at least through the lens of deontology, this practice is unethical because it fails to respect the dignity and the autonomy of the child. Right? This practice is not something that a child can consent to. You can't ask a baby boy, hey, do you want to be circumcised today? And he goes, yes, yeah. No, right? The child doesn't have the capacity to consent to this procedure. And so Svoboda kind of argues look, the child cannot give informed consent. And insofar as we're supposed to respect the autonomy and the wishes and the desires of other people, forcing an operation on somebody that they can't consent to that isn't life-saving seems to be unethical. That's the argument that he's making here. And so this is a picture of what one of the common devices used is to hold baby boys down for this kind of procedure. This is what he has to say about the ethics of circumcision. Okay? Violence may be defined as physical force used to injure or damage in the absence of an appropriate justification or consent. Circumcision is the removal of the male prepuce, foreskin, which excises between a third and a half of the skin system of the penis and nearly all of its fine touch neuroreceptors. Consequently, infant circumcision is a violent act. To be justifiable medical violence, an intervention must have the recipient's fully informed consent. An exception to obtaining informed consent is possible when there is a life-threatening emergency for which treatment cannot be delayed. When the patient is fully informed of the relevant options and makes a considered decision to undergo the procedure, the violence is no longer classified as a crime. Informed consent is crucial in protecting patients from aggressive, unnecessary, or unwanted medical intervention, and protecting doctors from criminal charges or legal actions being brought against them. The informed consent process grew out of respect for personal autonomy, the ability of an individual to have control over his own person, his own body. The modern concept of autonomy is usually traced to the German philosopher Immanuel Kant, who we've looked at in this class. He believed that all humans have an intrinsic value that cannot be bought or sold. As such, a person should always be treated as an end unto himself and never as a means to an end. Or, as we said, never merely as an object, right? Thus, to treat a person as a tool to accomplish a goal in which the person has no interest does not respect that person's intrinsic worth as a human. Kant also argued that in order to be a moral agent, a person needs to have the ability and freedom to make his or her own decisions. The concept of autonomy also underlies core ethical and legal concepts of freedom, the right to security of person, and the right to bodily integrity. To make decisions on behalf of someone else interferes with his or her personal autonomy. So, what Svoboda is saying here is that this practice cannot be consented to by baby boys, therefore it violates their personal autonomy, it violates their bodily integrity. This is not something that he thinks is cool, okay? It's not something that we should just allow unless there is actually appropriate moral justification for this practice. And so he also says that this is technically a violent act. And if it is true that it doesn't have any significant medical benefits, it's a crime. It's not actually a justifiable form of medical violence, he argues. It does harm to those who undergo this procedure. It damages their penises. And the implication is that this is going to have an impact on their long-term sexual function. This was his comment about the neural receptors, and this is something that the documentary gets into as well. The documentary tries to make a case that there are a lot of fine-touch neural receptors on the foreskin, and that getting rid of those things actually is going to make sex less pleasurable for men in the future. But that's something that we can argue about later, whether or not that's true. And finally, which we've already been discussing, this is a practice that the child cannot consent to. Just like a baby girl can't consent to female genital mutilation, a baby boy cannot consent to circumcision. Both of these practices involve violence to some reproductive organ. And so the idea that's kind of being implied here is that if we condemn female genital mutilation, we should also condemn circumcision, because these are analogous practices, right? This practice, Svoboda argues, violates their personal autonomy, their right to bodily integrity. And, as we might see, we might agree with Svoboda, it violates some of the core principles of bioethics. But we'll get to that later. He says, and this is where he starts getting into the legality of circumcision, whether or not it's legal. Infant male circumcision needlessly exposes the child's body to physical assault, short-term and long-term harm, and loss of functional tissue without medical justification or valid parental permission. Accordingly, rights under the UDHR, the ICCPR, and the CRC to privacy, to life, to liberty, to security of person, and to physical integrity are violated by circumcision. The UDHR safeguards privacy rights and guarantees that, quote, everyone has the right to life, liberty, and security of the person. ICCPR Articles 9 and 173 and CRC Article 164 contain parallel provisions making similar guarantees. As Robert Ludbrook notes, quote, the UN Committee on the Rights of the Child, which receives and comments on the reports filed by parties to the Convention, recognizes the Convention as granting children a right to physical integrity. Such a right, Svoboda says, is violated by infant male circumcision. Arbitrary or unlawful interference with privacy occurs in neonatal circumcision when a child's genitals are altered without valid medical justification and without consent of the individual. The right to life guaranteed by these three core human rights documents is also needlessly placed at risk by human circumcision. Bollinger estimates that at least 100 infant males die as a consequence of circumcision each year. These are known as botched circumcisions in the USA. UDHR Article 292 is widely interpreted to prohibit interference with physical integrity. Circumcision, however, constitutes a violation of privacy and of physical integrity. Under CRC Article 19.1, it states that people must take all measures to ensure that no violence, injury, or abuse occurs while the child is under the care of a parent or legal guardian. The USA fails to take all measures to ensure that no violence, injury, or abuse occurs in violation of this article, and effectively promotes, by financially supporting those who perform the procedure, and condones the violence, injury, or abuse caused by neonatal circumcision. Another article provides, quote, "No child shall be deprived of his or her liberty unlawfully or arbitrarily. Neonatal circumcision requires the temporary deprivation of a child's liberty by physically restraining him in order to carry out the procedure." Article 24 of the CRC specifically addresses health issues. Section 1 obligates state parties to recognize the child's right to enjoy the highest attainable standard of health. Section 2 requires states to pursue full implementation of the child's right to enjoy this standard and to take appropriate measures to, among other things, diminish infant and child mortality. But you can see where this is going, right? Section 3 requires that parties take all effective and appropriate measures with a view to abolishing traditional practices prejudicial to the health of children. And other articles set forth similar protections, providing that every child shall have the right to such measures of protection as are required by his status as a minor, on the part of his family, society, and the state. In sum, the USA tolerates male circumcision while simultaneously outlawing forms of female genital cutting that remove no tissue and thus are less invasive and cause less damage than male circumcision, which removes up to half of the penis's surface tissue. So here Svoboda, using his lawyer knowledge, his legal knowledge, is talking about all these different provisions and rights that are afforded to people in virtue of being human and in virtue of being minors. And he says, look, circumcision violates all this stuff. Okay? Thus he argues, he tries to make the case that infant male circumcision is illegal. It's both unethical and illegal. He draws a parallelism between cases of female genital mutilation and circumcision as it is practiced in the United States. And he says that most cases of FGM are less invasive, cause less damage, and are condemned as conflicting with human rights, but yet people don't feel the same way about circumcision. So there's an inconsistency here. In fact, I think he would argue that most cases of circumcision in the U.S. are more damaging and cause more suffering than cases of female genital mutilation that are practiced in other parts of the world, though some of them are definitely worse. And he brings to bear some cases on this issue, and he says that they suggest that parents cannot justifiably give consent on behalf of their children. Why? Because this isn't a necessary medical procedure. It isn't a life-saving treatment. Parents can give proxy consent for their children in terms of saving their lives, right, if they need some sort of emergency operation. But he says circumcision is not an emergency operation, okay? It's not necessary. So parents can actually give consent in this case. He goes on to argue that circumcision violates the 4 pillars of bioethics: justice, autonomy, beneficence, and non-maleficence. These are pretty self-explanatory, right? In medical practice, we should try to do what is just. We should try to respect patient autonomy. We should try to do good where we can, beneficence, and we should try to avoid doing bad to people, non-maleficence. While I think Svoboda would argue that this practice is not just, I think he would also argue that this practice does violate the baby boy's autonomy. He would probably also argue that in a lot of cases, doing this is not beneficent, it's not good, and it doesn't try to prevent harm. So I think you can make a case that based on Svoboda's reasoning, it violates all 4 of these central pillars on which bioethics is based, and then we use to evaluate the ethics of medical practice. And he makes the case that this practice is a human rights violation. He talks about a number of different rights he thinks that are being violated by circumcision. First, the right to informed consent. The child is cannot consent to undergoing this procedure. But all medical practice is supposed to secure informed consent first. In fact, in the U.S., healthcare systems tend to err on the side of respecting personal autonomy, even if people are denying life-saving treatment. But obviously, in cases of circumcision, the child cannot consent to this practice. So that's one thing that's violated. He says it violates the right to personal autonomy, to bodily integrity. Right? We're supposed to own our body and be able to do what we want with it, the implication is. Well, when you force someone to undergo a medical procedure they can't consent to, you are taking away their right to bodily integrity, or you are violating that. It also violates the right to bodily autonomy, which is a little bit different, to be able to do whatever you want with your own body. There's bodily integrity and then bodily autonomy. There's a distinction between these two, but you don't have to memorize that. He also says it violates the right to bodily liberty. What people are allowed to do with their bodies, the kinds of things that we are allowed to say no to, right? And he actually tries to make the case that circumcision is actually discriminatory. Because in cases of female genital mutilation, we all recognize that it is unethical and illegal, but yet we basically do the same thing to baby boys. So if that's not discrimination, he's like, what is? It's okay because it's a male? And finally, he says, under certain provisions, it actually fits the definitions of torture and child abuse. If you look at some of the governmental and legal provisions that various organizations have laid out for what constitutes child abuse and torture. Not all of them, mind you. So he has some pretty damning things to say about circumcision, right? He thinks it's unethical and it's illegal, and therefore that we ought to change our attitudes and our policies and our laws surrounding it. He thinks that baby boys shouldn't be put under the knife. Rather, they should be able to grow up and make the decision for themselves when they can consent to the procedure if they want it or not. It shouldn't just be done to them without a second thought, for the aforementioned reasons. And he implies at the end of the article that there's a lot of work that needs to be done to get people to recognize the issue for what it is, and the ethics of it. And he says that we can go about changing people's minds if more people give their testimony, if we spread awareness of this issue. Changing sex ed and what is disseminated in the culture will help fix this issue. And we're already seeing groups pop up that try to spread awareness about this. If you watch the documentary, you will have encountered a lot of interviews with guys from a group that they call themselves intactivists, which is a play on having an intact foreskin. And they argue against male circumcision, and they try to spread awareness about this issue. Some of them are even trying to do things to repair the foreskin that they have lost due to circumcision. But if you watch the documentary, you'll see that. So that's basically the case that he makes. He thinks it's unethical and he thinks it's illegal. And if we condemn female genital mutilation, we should also condemn infant male circumcision. So, what do you think? Do you think he makes a good case here? Or do you think this is silly?
I mean, by technical definition, it is illegal.
Will you say more?
So he's right with the medical stuff, because a parent can only give consent for a child when it is a emergency life-threatening situation or a necessary medical procedure that could turn into a life-threatening situation.
Okay.
So if I take a child, I can't necessarily get the child's consent from the parent, but if it's an emergency, I have to get some representative to sign. And when I take someone to the hospital, they have to be alert and oriented of sound mind.
Okay. So you agree with the case that he makes that this practice is illegal?
100%, it is illegal.
Under our technical definitions.
Now, having said that, if there is a religious reason for it, then our Constitution demands that it is not illegal.
Right. So that's another big thing when talking about this topic, right? Should it be allowed in cases where somebody is trying to practice their religion? Right? In the case of Jews who want to circumcise their baby boys, should that be allowed? Oh, that's an interesting question, right? Anybody else? What do you all think? Do you think he's right?
I'm pretty in support of it, and I think that his argument about it being the same as female genital mutilation can be completely nullified because male circumcision doesn't lead to nearly any complications. There's always the risk for inflammation or bleeding after surgery, but female genital mutilation later in life will lead to cysts and fertility problems and a lot of other complications, and there genuinely isn't a necessity to it, where you could even make the claim that circumcision is now so popular it's an aesthetically pleasing thing.
Well, right. That's one of the common arguments that's brought out in favor for it, right? Yeah, so maybe in a lot of cases of female genital mutilation, it produces harm down the road, like bad health outcomes down the road. But what about his case that it is unethical because of the damage that it does to the child? Do you think it's not unethical?
I don't think it does much damage to the child whatsoever, and the only, physically at least, because the child's too young to remember painful surgery, and in most cases, especially when it's done for religious purposes like Judaism, they give the baby a lollipop dipped in alcohol, and then the baby sucks on it, and they don't feel the pain, they don't even cry after the procedure.
Okay, so that's an interesting point. You said that they're not going to remember the pain, but that doesn't mean that they didn't feel it, right? That they didn't undergo a painful circumstance. So it sounds like you're saying, for health reasons and aesthetic reasons, the minimal amount of pain that they experience is justifiable.
I And I don't think that it would be a problem like for the person. I don't think they'd stay up thinking about it, like upset, unless people decided to make it an issue.
That's interesting. Because a lot of guys don't seem to think about it, right? If you watch the documentary, though, you'll see a lot of interviews with guys who are very upset about the fact that they were circumcised. And they are very angry at their parents. Yeah?
Going back to like the ethical thing, I think something can be unethical but also be like the norm. And
Yeah?
so like
Yeah?
obviously it's like the norm in our like Western society, but that doesn't mean that it's like ethical to like hold a baby down, like cut them and stuff, but you know, it's like the norm in our like culture. So
Right, yeah. It's possible for something to be normal and unethical, right? I mean, think about just a lot of things that are normal in our society. I don't know. Consumption of maybe foods that aren't good for you are pretty normalized, right? Lack of exercise is pretty normalized. Lack of a good sleep schedule is pretty normalized, right? Are any of these things ethical for you? You know? Maybe you might even say, if you're more progressively minded, that a lot of institutions exploit their workers. That's normalized. But is that ethical? No, a lot of people would say no, right? Yeah.
I just think all this stuff about like violating rights of the child is just like I don't really believe that.
Okay.
It's like kind of like what Bill said. Like I don't remember anything before the age of like 5 maybe, and I don't even think I learned about what circumcision was until like middle school. So I almost feel like he's just trying to manufacture a problem here. And like if you tell people about this thing, like, oh, this is a problem, you make them think that it is. I think you could get some people to believe that it's an issue, but like me personally, listening to all that, I'm like, I don't see any problem.
Okay, so it sounds like you're saying something like children don't or shouldn't have the same rights as adults.
Yeah, I'd say so.
Okay, yes, Svoboda doesn't agree with that. He just thinks in virtue of being human, we should have the same rights. Like the right not to, I don't know, be cut, for example, or something, you know what I mean? Because that's what the whole case is, but yeah. And certainly there's precedent for allowing adults to make decisions on behalf of their children, right? Like adults have to take care of their kids, right? You can't let kids make whatever choices they want, right? They'd probably kill themselves, right? So you need to safeguard them from certain things. You know, sometimes, you know, no, little Jimmy, you can't run across the road whenever you want. Like, I'm going to grab your arm, you know, like, okay. Yeah, I think I see what you're saying.
Dude,
Yeah.
I'm not seeing how you can agree with this here. I mean, like, you're chopping off skin for no reason here.
Okay, so you do think it's unethical.
Yeah, I'm like, dude, there's no point. The whole aesthetically pleasing thing is completely subjective. Like, if you went over to the Eastern world, they'd probably say that the Western is a weird way of doing it, you know?
Yeah.
And, I don't know. Let people, can't you do a circumcision at any age too? I think you can do them at any age.
Yes, in principle, it can be done at any age.
Let the 18-year-old do it if they want to do it. Leave the skin on them.
That's what Svoboda is arguing. Yeah, he thinks this practice is barbaric and unnecessary. But it's interesting that there's some varied opinions here. I like that. This is going to make the discussion more interesting. Yeah.
Isn't it like worse off? Like not worse off, but isn't it like much more? Well, it's obviously more painful because you feel it when you're older, and like you'll like actually remember doing it, and you'll kind of have to. Will you be able to like, move around and stuff after you get it done when you're older?
Well, there's nothing saying that you can't have some sort of anesthetic, you know, for the procedure. It's just that the way that it's practiced in the U.S. on infant boys, there often isn't anesthetic. And it is true that most, if not all, like boys don't remember this procedure. So there's that element to it too. But
I definitely think I'd rather not remember it.
well, yeah. If I had the
I would share that opinion too. Like getting it done when I'm
Do you think there's value to giving people the choice, though?
Not really.
No?
I think it's so normal that it's just like, no. Me personally, maybe somebody else, they have a different opinion or they might care a little bit more, but for me, it's like, no, I don't see the value in that.
Okay. One of the things that the documentary brings up and that Svoboda talks about a little bit in this article is cases in where it goes wrong. There are tens of children who die every year, boys who die every year due to botched circumcisions, and they bleed out on the table. He would say, like, look, this is a barbaric practice. Like, we can eliminate all those deaths if we just let them make the decision when they're older. But maybe the practice has benefits such that it outweighs the deaths of those kids. What do you think?
What is the health benefits of getting circumcision?
Oh, I'll go back to them. It's argued that circumcision helps prevent certain infections, helps prevent contraction of certain STIs, that it's aesthetically pleasing. Here you go. Yes, you can find data to support this. Yeah. Except, so here's one of the funny things. It's argued that circumcision helps reduce rates of penile cancer. But you might think the reason for that is, well, yeah, of course, cutting off an arm would decrease rates of arm cancer. Right? So maybe that's not a good argument in support of it. But you can find data to support that circumcised men contract these diseases at lower rates and these infections at lower rates. Then the question becomes, is it because of the procedure or is it because of lifestyle? And, we can have a debate about that.
So, even if it might be illegal, it is still illegal under our law?
Technically speaking, Svoboda thinks so, yeah.
Technically speaking, it would be illegal. That doesn't mean it's not ethical, though. That just means...
Yes, the legality, I think we can separate the legality of something and the ethics of something, right? There are a lot of things in our society that are legal that are not moral, right? And vice versa. Things that are made illegal that don't seem to be immoral at all. Like, is jaywalking immoral? Is spitting on the sidewalk immoral? Probably not, So is this something that y'all have ever thought about before? That you've ever encountered? Where did you encounter this before, if you have? Or talked about it before, or heard about it before? Looking at one of you two.
I don't even remember. Like, I actually don't, but I remember talking about it in my car with someone.
Oh, interesting. Okay.
No, like, I actually do. Like, I think it just, randomly came up. And I was like, would you circumcise your kid? And they were like, yeah. And I was like, but, why? And I was like, but, I feel like I would, too. And, we just, talked about it. Because, it's just so normal that it's, yeah, it's just kind of... Also, I have a question. Is it, free to, do it? Are you paying for this? Or, is it paying for this?
I honestly don't remember the answer to that question. It might be addressed in the documentary. I'm not sure. So check it out. It's free. You can find it online. I have a link to it in the syllabus. But again, it does contain some graphic images. So just be prepared if you're going to watch it.
I remember talking about it now. It was after we went through and we picked the topics we were talking on. And
Oh, yeah.
I went in the car and I was like, oh yeah, we're going to be talking about this. So I'm not crazy, everyone. I promise. I don't just randomly I think this is me bigger thing.
Where did you hear about this, Georgia?
Okay, so when my mom, I have a little half brother, and my mom, my stepdad, he's from Burkina Faso, so he's from Africa, and they don't circumcise babies, and I remember being 10, and my mom and my stepdad arguing not circumcising him, we don't
Okay.
And like for someone who's not American, it's like really weird.
Yeah, so from those who have lived outside of the U.S., can you offer any insight into how circumcision is viewed? Is it supported? Do people have positive opinions of it? Yeah.
I mean, like in Canada, like it's almost like 50-50. It goes both ways.
Okay, so there's like a strong group against it, and there's a strong group in favor of it?
Against it, it's just like they just don't circumcise their kids. Like you get it. I don't know what it's like here, but they usually will like ask if you want to do it, and then I don't know. They don't like. It's not really like as big of a thing in Canada as it is here, I think.
Okay. And I know in some European countries, it's not. It's like the other end of the spectrum with regards to attitudes about it here in the U.S. People in the U.S. generally are like, it's not a big deal. Like, that's just something we do. Whereas in other parts of the world, Western parts of the world, it's like the opinion is switched. It's like, yeah, of course it's wrong. Why would we do that? That's obvious. Like, we don't do that. Like, it's not a question. So it's interesting how this practice is or is not done in different parts of the Western world, right? Of course, all the data that the various doctors and researchers bring up in the documentary and in this article can be contested. I would encourage you to look it up yourself. Basically, what Svoboda is trying to do is raise awareness on this issue. He thinks it's not something that people are considering, and they should. Because if you just go along with the cultural practice, he thinks that you're doing something unethical and illegal. Okay? And he doesn't think that's cool. Again, he makes a parallelism between this and female genital mutilation. And he says, if you think that is unethical and a human rights violation, you should also think a lot of cases of circumcision are too. And if you don't, you're being logically inconsistent. One thing that we haven't talked about yet is whether this should be allowed for religious reasons. What do you think?
Yeah, it's a culture.
It's a part of their culture, right? But there are cultural practices that we think aren't cool, right? Like cannibalism is a cultural practice, and it used to be in some places.
Not anymore.
It still is all over the world.
Not in the U.S.
Sean? Yeah, thank God, not in the
Not
U.S.
in the U.S.
I mean, if it's like a must within a religion, why does it have to be after or as soon as possible? Because I believe, if I remember correctly, in the Jewish faith, it's like 8 days or something after a child is, or like within 8 days a child is born, you have to circumcise them, I think.
If it's based on the Abrahamic covenant, yeah, it's 8 days. Yeah. Yeah, you might ask, like, why doesn't the child get a say in whether or not they want to enter the religious community of their parents?
They don't even know who they are at the moment.
Right. So should something be done to them to signify they're a part of a religious community that they, can't think about or consider?
No, our church does have to wait for children.
Yeah. Although there's growing support nowadays for people to heavily criticize the way that people parent their children, right? And say that they should be taken away from them for a wide range of reasons.
I mean, yeah, there's a fine line fine line between that, but I'm not gonna detrimentally have any life-threatening issues on them. Don't judge what other parents do.
Okay. Yeah.
I was just going to say, what's the difference between parents deciding that they want their kid to be circumcised for cultural reasons, or like what you just mentioned, like being entered into a religion?
For religious reasons?
Yeah, like I don't see a difference there.
Well, one is a right protected under U.S. law, right? Like the right to religious expression. You might argue that like circumcising your kid is like a form of religious expression.
Oh no, I understand that, but I'm saying to to the child what's the
Oh.
difference. Like the parents are still deciding for them.
Yeah. Yeah.
And probably better when you get it when you're a baby anyway, you're not gonna remember any of it when you're older.
True, but a lot of people don't remember painful experiences they've had, and that doesn't make it like good that it happened to them, right?
They still PTSD from it.
Well, right, especially if they have trauma or something, right? That's not good.
I don't think though that like there would ever be a law like this because like America is like very specific about like the parents having like the right to raise their child like their children however they want and like we're the only country in the world who has to sign like the Children's Rights Declaration and like it's because we really value like parents having like the opportunity to like raise their children how they want. So I don't think that there would ever be a law like this because it's going to be so hard to like limit it if it's for like.
When you say a law like this, what do you mean?
Like telling parents what they can and can't do with their children. Like.
Oh, okay.
Like I don't think that that's. I don't know. Like I don't think that would actually happen because like it's in the Constitution. Like freedom of like religious expression. Like I don't think that there would be a law like that. Like I think it'd be very hard to get a law like that in place.
Yeah. Yeah, right. The issue is people generally respect the right to religious expression when it doesn't affect them. But in cases in which it does infringe on somebody else's rights, that's when, people say there's an issue here. And the case that Svoboda is making is even if this is an example of religious expression, it's infringing on the rights of the child. Now, whether or not you think, children have rights or should have rights, we'll have to talk about that. And that's going to inform what you think about this issue, right? It seems like in some cases, there are justifiable violations of children's rights, right? Like when it comes to life-saving medical procedures, right? We don't need to get the child's consent to save their life, and we think that we should save their life even if they can't consent to it, right? But Svoboda, of course, is going to say circumcision is not like that. Circumcision is unnecessary, so on and so forth. Yeah. Was there another hand over here? Did you want to say something?
No, but I was just kind of thinking about if parents are like making these decisions for their kids, it's probably something they believe in.
Yeah.
So like we should.
Yeah.
I feel like we should leave a lot of those decisions to the parents because it's going to go hand in hand with just how they live their lifestyle, which is in turn going to how they parent their kids. I just think it all kind of goes hand in hand. You don't want unhappy parents because they couldn't get their kids circumcised or they were forced to leave them uncircumcised, and then what if you had a kid that resented their parents for not getting them circumcised as a kid? I just feel like, I don't know, you take away the choice of the parents, it kind of, I don't know, I feel like there would just be unhappy decisions there.
Okay. Do you want to respond to that, Sean?
Yeah. So I'm going to just start off with two extremes, like absolute resentment for being circumcised, it's understandable, but it's still extreme. On the other hand, being overly grateful for being circumcised because of the parent's decision. Again, understandable, but extreme. Like, me personally, my brother and I, we were raised Catholic, and, we did the things, but we both grew up, probably not in this religious image that our parents probably intended or wanted to raise us by.
Mm-hmm.
Obviously they're great parents, but I don't think me personally, if your parents truly wanted to pave the way for you to have the best life, they would want you to do your own decisions and live your life, not and there are some cultures that your parents give you pretty much everything. They push you to your limit. You excel at almost everything. And then whenever you're older, you repay your parents to the best of your abilities. Not a lot of families in the United States do that, but I think it's something like that, if that makes sense. It was kind of all over the place towards the end.
Well, it would be interesting to ask, how many people, like, would there be a lot of boys who would resent their parents for not getting them circumcised? And compare that to, like, how many boys are there who do resent their children or their parents for getting them circumcised? Like, it seemed, if you watch the documentary, apparently there are a lot of guys who are upset that this was done to them. They feel almost like betrayed, right? It makes me think about, circumcision is such a normalized practice, but what if we just thought about a different surgical procedure? What if it was appropriate to, just cut off a piece of the arm on a boy's skin? Should parents be allowed to do that?
If it's cancerous, yeah.
Sure, if it's life-threatening, right? Does that change it? Is it because circumcision is related to our religious expression and our cultural practices that it makes it valuable?
And these parents are looking out for what's best for their child regarding their health.
Well, I think a lot of parents are trying to do that, yeah. The question then is, does this serve that or not? It certainly doesn't serve the kids who died because of it, but...
And you should just do the butt. That's just not practice then.
Have you no knowledge of cleaning it?
Well, so yeah, that's another thing that's, yeah.
Yeah, I think that goes back to like proper education and, sexual education and support with all of that for everyone. Doesn't matter who you are. It's like, hey, you gotta wash yourself. You gotta clean it. You can't just, call it a day. Let the water soak right down your body.
Yeah, it's still, I think, a question that is being debated whether or not the medical benefits of circumcision are actually like due to the practice and not due to other things like lifestyle. Like, yeah, that's something that you can look into. I don't have all the data on that.
I also think it's interesting how they're saying circumcision prevents STIs and stuff, because there has to be a certain risk. If you're not practicing safe sex, then you can probably get an STI either way. So I would be curious to see the data if it's really safer or yeah.
Yeah. Well, some of it is brought up in the documentary. The documentary does try to portray both sides, although you'll see, I think it skews towards the anti-circumcision side. So, but I would highly encourage you all to watch it because I think it's very interesting.
If there were different practices put in place, wouldn't people eventually, wouldn't it just shift to the opposite belief? Don't you think, if there's already two ends of the spectrum, don't you think the same thing would just happen if not being circumcised was the normal? And then what would be the result of that? Well, if circumcision is decreasing rates of STIs and infections, then I think normalizing, not circumcising boys' newborns, those numbers are just going to go up, and people are still going to feel the same way, just let.
That's one of the cases that the doctor makes that they interview, who's pro-circumcision in the documentary, and he's like, look, if we stop doing this, that's going to create bad health outcomes in the future. So I am always in support of circumcision. I write in support of it. I try to tell parents, get your kids circumcised because it's good for them. Yeah. If you think the data shows that, then yeah, you would be in support of it, right? So yeah, there are a lot of difficult questions here. I would encourage you all to think hard about this issue, okay? Don't just ignore it because it's something that's normal, but actually think about it, right? Make up your mind about it, look at the data. Again, if you haven't done so, watch the documentary, because this is something that is becoming more hotly debated, and I think this discussion is going to become more popular in the future. And if you have kids, if you have a boy, you're going to have to make this decision yourself, right? So this might be an ethical issue that you actually face in your own life. So think about it, all right? Okay, does anybody have any final questions, concerns, comments? Otherwise, I'll let you go a little early today. Okay, well, thank you all for coming. I know it was weird, I know it was a little awkward, but it's something that I think is worth discussing. Okay, this is an ethics class. Okay, thank you.